Hello, everyone. My guest today is Dr. Christopher Stepien, founder and CEO of Barefoot Rehab. So Barefoot Rehab, located in Denville, New Jersey. Hello, Chris. How are you?
I'm great. How are you, Dimitri?
I'm great. So, Chris, so tell me your rehab, so you're a chiropractor, what kind of specialties you have within your clinic and what services you offer?
I love it. We specialize in helping patients who have had pain more than 6 months and seen at least 3 other doctors or therapists without relief. So they could have seen chiropractors, physical therapists, massage therapists, medical doctors, it doesn't matter, but it has to be a minimum of that many doctors or therapists. And we help those people get permanent pain relief. That's why they come to our clinic. And the primary way that we do that is through adhesion removal. We are New Jersey's only adhesion removal certified clinic, and that's what our doctors are specifically trained in.
So let me just confirm. So you guys use a holistic approach, or you specifically use a holistic approach, or is it that your, rationale for all the treatments is holistic? Is that correct?
Yeah, we use a holistic approach. Of course, our primary specialty is adhesion release. So how are the muscles functioning around degenerated discs and joints? But within that, the first thing we do is we diagnose people completely and as precisely as can be. So we call it a diagnostic list. So if they have 4 things on their diagnostic list: a moderately degenerated low back disc, moderate adhesion in their low back and hip structures. If they have systemic inflammation in their body, we'll either help them with some diet or point them in the right direction of a functional medicine doctor. Or if they have some other condition, whether it's they only sleep 5 hours a night, or they're always in fight or flight nervous system activation, or whatever else it is, we address those components and either have them address it themselves or help them to the extent that we have the tools to address it.
Mm-hmm. And for those listeners that are not familiar with adhesions, because some listeners might think of adhesions as post-surgical adhesions, can you tell us what adhesion release is?
Yeah, adhesion release fits within the category of myofascial release or myofascial work. The way that my instructor taught us to work, Dr. William Brady of Integrative Diagnosis, is he just made it way more precise for us in order to treat adhesion. So it can be post-surgical adhesion, but it's often adhesion either from trauma or more commonly from overuse. And we've been taught how to identify the location of very specific adhesions, sometimes as big as just a little piece of dime,
Mm-hmm.
and remove only that piece of adhesion. We're not doing an hour and a half of massage. We're not doing an entire muscle. We're trying to find the little bits of adhesion that are causing their muscles and their joints to not function well, and get those muscles to stretch and then function and contract the way they're supposed to.
Got it. Thank you for the clarification. That's great. And Chris, so you went to New York chiropractic school, is that correct?
Yes, sir.
Yeah. And when did you open your practice?
2010.
2010. So that was a year after graduating. Is that correct?
Yes, sir.
Okay. And did you work anywhere else prior to opening your clinic?
I didn't want to. I'm definitely one of those proactive go-getter types, and I wanted to put my own flavor on whatever getting people healthy and out of pain would be.
Sure.
I just dove right in.
So the reason I'm asking, as you said, a lot of listeners, they, interested in running their own clinic or they already have one. And most of therapists, chiropractors, doctors, prior to opening their own location, they usually work somewhere for someone, right? So, and did you start right away full time? You finished school and right away you went all in. What was your first location, and where is it? The same location you're in right now?
Yeah, I knew the strategy with which I wanted to start the clinic. So for about 2 years prior to graduating, I was doing a lot of CrossFit, and I loved it. I got certified. And I started the clinic in a CrossFit gym. I knew that they were hardcore with their workouts and they were going to hurt themselves. And I also loved it. So I wanted to help those types of athletes. And it grew very quickly. So I found a good gym with a good owner. She believed in me. I helped her. She referred people to me, and then it just kind of took off.
Are you still within the gym?
In 2012, I started my own CrossFit gym. I was there for 5 years, and then the gym did not do well, and I also realized that I no longer wanted to work with CrossFit athletes. So I am not in that location anymore. I've been in the same location I've been in for the past 3 years, and it's more of a doctor's office. It's a nicer doctor's office, but I didn't want people in chronic pain to think that I was just working on athletes. So it was just more of a choice of the type of patients I wanted to work with.
But so you're not working with CrossFit athletes at all? It's
Not at all. And I wouldn't say at all. We have a few, but it's not even close to the same percentage of patients that we were treating.
Got it. And did you have any partners when you started, and do you have any now?
I never had any partners. I currently have another doctor who is our chief of operations. So he is largely running more of the clinic as I focus on some other aspects to the clinic and healing and so on and so forth. So I plan on taking partners in the near future, but I haven't had partners yet.
Got it. Okay. So all the locations you've been in, you've been solely the only owner. Okay.
Yes.
And so would you say the population that you service now, is it mostly chronic, related conditions, patient with chronic conditions, I should say?
It's the majority is chronic musculoskeletal conditions. Since COVID hit, we've been exploring helping people with more idiopathic chronic pain conditions like fibromyalgia, CRPS, different conditions like that. And that's still an exploration, but it has to be chronic pain, and they have to be very motivated to get out of it.
Sure. Yeah. Motivation is a must in rehab.
It's a must.
The most. So speaking of COVID, how has business, been affected since COVID started? Are you guys back to your capacity where you were in March or February, or are you still not there yet?
Yeah, we definitely took a hit. As soon as we had our best week ever, the week before the shutdown hit, we hit a new milestone with patients, and the next week hit, it's just way dropped off. We've gotten back to probably about 70% capacity. We're still not back yet, but because of our margins with the type of practice we have, we're generally okay. We did have to put some doctors and staff on furlough, but we're doing okay. So we're just continuing to put the time and energy in to the point where we're back at full throttle, and then we can continue to grow from there.
Makes sense. Chris, have you made any adjustments in terms of treatments with COVID, or you guys just followed the same protocols and your telehealth involved?
We very short period of time tried the telehealth thing. It really didn't speak to us. The only thing that we did since COVID was we did implement a virtual chronic pain relief course. So we created a 10-week chronic pain relief course where the people with fibromyalgia, CRPS, other conditions like that can come and get permanent pain relief. Okay. So that is something that we've been implementing, exploring. We've been getting good results with it. The hardest part about that is I'm finding it really hard to get any type of person with fibromyalgia to trust that there's any answer. Even in our marketing, we've guaranteed pain relief results and still had a hard time in people wanting to try it with us. So it's going well, and we'll see where time takes it as far as if the program continues to grow or what we do with it.
Mm-hmm. And for fibromyalgia, is there a specific technique you guys like to use, or is there variety of different things that you guys use?
Yeah, we're essentially, from my own perspective, of course, putting a well-rounded approach to the major aspects of chronic pain. So eating an anti-inflammatory diet without cheating for at least 30 to 60 days, sleeping at least 8 hours a night, doing a lot of emotional processing around our childhood traumas and recurring negative emotions, guilt, shame, jealousy, sadness, anger, whatever else it is. Um, some movement outside, little bits of exercise, but not pushing through or forcing through any pain. Drinking lots of water, working on our relationships. So everything besides the adhesion aspect
Sure.
from a lifestyle perspective.
Got it. Very good. So do you utilize any dietitians or nutritionists as consultants or any other specialty at all?
I would love to incorporate dietitians or functional medicine doctors. I haven't established any relationships with them at this point.
Uh-huh.
Um,
Okay.
there are a few good surgeons that I have relationships that I refer to, but no, I don't have any other deeper relationships. I'd like to.
Very good. So actually, we're going to speak about referrals in a few minutes.
Love
So what was your initial investment when you started your clinic in 2010?
nothing. Um, I don't know. What's like a table and a license? Probably a few $100s.
Okay. And how many days were you working in the clinic? Is it
At the
like
start,
at the start? Yeah, like first 3 months, I would say.
first 3 months. I was pretty much only going when I was treating patients, but I think I want to say within 6 months, I was treating like 60 or 70 patients a week.
Oh, wow. You
You
picked
know,
up really quick.
she referred the heck out of me. I was really blessed.
Wow.
Cariana Hunthies.
Uh-huh. Uh-huh.
Um, so what is that? Maybe 20 or 30 hours a week in the clinic. And
Right.
at the time, I wasn't really doing any other marketing.
Got it. Got it. And so how many people work for you now?
Right now, I have 3 doctors who work for us, and then a staff of 12 to 15 people or so.
Oh, wow. So, okay. So, and then all doctors full time?
I'll describe it this way. One doctor is at capacity. Another doctor is about 50% capacity. The other doctor, I've been training since January, and he's probably seeing 10 patients a week, and we're just slowly feeding him patients as he's delivering results.
Got it. And is it the same since COVID? I mean, during COVID, I should say, as pre-COVID, or it was a little different prior to COVID?
As far as which aspect?
Capacity in terms of your doctors seeing patients.
Yeah, the neck doctor is as busy as he was before COVID. The leg doctor is not where he was before COVID yet.
Got it.
Yeah, and the new low back doctor he's the one I'm still training.
And that's how you break it down. You have doctors specializing in cervical pain, right? And doctors specializing in lower back pain and then lower extremities, right? Is that how you guys run it?
Yeah, we divided the body into 4 body regions with the rationale that most intelligent people who want surgery, they don't want a surgeon who does all body parts. They want someone who does all low backs. And so my theory is that intelligent people who are also willing to pay more money want a specialist who does only a body region and who does only adhesion, who doesn't do adjustments, who doesn't do other stuff. So our goal is to be the best adhesion doctors in the world. And so that means that we have to focus our energy and time on just that body region.
Very nice. I like that. Yeah. Yes. I mean, I'm a big believer in specific specialty, regardless it's a surgeon or therapist, chiropractor, you're less likely to make mistakes, right? If you're treat specific part of the body. And Chris, so I'm assuming you don't take insurances. Am I correct?
We do take some out-of-network insurance. We're mostly cash.
So mostly cash and out-of-network. Got to keep you up. Do you take Medicare?
No.
No.
They pay like $30 in a
$30. Yeah. So
I can't.
Right. So the reason I asked, so when I interview physical therapists, occupational therapists, Medicare is actually a higher paying payer, right? Physical therapy. But I know for chiropractic, since it's not timed visit, they pay just like $30-something, $32, $37 per visit. Correct. So yeah, I know a lot of chiropractors don't want to deal with that. Okay, very good. And how big is your office? How many square feet approximately?
Right now, it's about 1,500 square feet. It's tiny. We're definitely bursting, even at our current patient numbers, bursting at the seams. So right now our staff knows that we're working to grow to be at least 100% capacity where we were, and then we have plans to grow to about a 4,000, 5,000 square
Oh,
foot.
so you gotta not just double, you gotta actually almost triple.
Yeah, I have this vision of a clinic that's just like really beautiful and healing just by being in it, and we're a lovey-dovey clinic as well. Like we like hugging our patients when it's not COVID and just telling them about stress
Yeah,
and
yeah,
calm the body down. So we
sure.
really want to create an environment that people can heal just by walking through the front door.
Uh-huh. And then for out-of-network patients, you guys actually submit bills, or you give patients like an invoice, so they submit it to their insurance.
Yeah, it depends. If they paid a $4,000 case fee up front, we'll give them super bills they submit themselves. But depending on what their benefits are, if they're paying a fee per visit, then we will sometimes submit for them. So it just depends on the logistics of things and where they're at.
But you also have patients you charge per visit, not just, or you always offer like kind of a bundle plan where you charge for some amount of visits upfront at a discount.
Yeah, because neck pain and low back pain are arguably the top two most common complaints. Those are generally case fee areas. So people will pay an upfront sum because they really want to get better and they demand a higher quality of care. So that's when we just say, you know what, to put our energy and time into you, you have to pay this upfront sum.
Mm-hmm.
Right now for the arm and the leg complaints, it's more fee per visit. So we continue to see how that evolves, but we want to just continue to demand as much value as we deserve if we're helping somebody get out of chronic pain.
Got it. Okay, thank you for that. And then which documentation system and practice management system you guys use in your office?
Yeah, we're super old school, pen and paper.
That's interesting.
We did try a system,
Uh,
but we just wanted it to be as precise as possible with as little headache as possible for us. And especially given the integrative diagnosis system, our mentor recommends that we just stay pen and paper until someday there's a system good enough that there's no further hassle or headache. So yeah, we're old school.
okay, that's fine. And then, so the reason I'm asking for practice management, so how do you run reports? And what do you keep track of, amount of visits, referrals, etc.?
Oh, got it. Google spreadsheets. So we have two gigantic Google spreadsheet documents with like 10 different tabs.
Uh-huh.
And so that's how we track our KPIs, patient numbers, who referred who,
Got it.
lead generation
Sure,
sources.
sure,
Yeah.
sure. Okay, very good. And then in terms of referrals, so out of, let's say, if you were put it into percentages, out of 100%, who's your best referring source? Is it other doctors? Is it advertisement like social media, maybe newspapers, radio? What would you say?
Yeah. A few years ago, it used to be primarily referrals. And at the time, it was Google SEO on the website. In the past couple years, it's definitely been number one, Instagram, number two, Instagram and Facebook ads.
Mm-hmm.
So when I wanted to go from one doctor to four doctors, that's when I really started investing money into those ads. And I'm so happy I did. A lot of people told me not to.
Uh-huh.
And then because of that as well, our Instagram profile also increased, and we definitely spend a lot of time on the quality of our content, both videos and posts. And that is also a huge asset. So Instagram, Facebook ads, and then third is referral.
Got it. Okay, so uh, what is the name of your Instagram, by the way?
Barefoot Rehab.
Barefoot Rehab. Okay, very good. And then, so you're saying social media, it's over 50% referrals, right?
I would say over 50, yeah.
So what are some specialties? So now I want to talk about other medical professionals that refer
Sure.
patients to you. What's the best specialty in terms of, maybe it's orthopedic surgeons, the old doctors that refer patients to you?
As far as which type of doctors refer to
Right,
us,
right. Mm-hmm. Would you say?
it's not even that many. It's mostly patients.
I see.
I haven't found that. I have a few relationships, but it's here or there. I can't even think of somebody off the top of my head as a
Got it.
doctor. I
Okay.
mean, it's sad, and we do refer to other surgeons, and
Got it. And so
It's
you're
so
doing,
cutthroat with the doctors.
yes, it is. It is. It is. So you
Man,
can ask, a lot of rehab special, you ask, I could interview someone and so against doctors, saying doctors are evil, they don't refer, they spend so much money on marketing. And I have other clinics that solely work with doctors, they have good relationships, and then they say 80% of their referrals come from doctors. So I always like that question because, like I said, people, they're starting a clinic or running a clinic and they're not sure where to put their money, right? In terms of marketing. So so I wanted to kind of listen to different episodes and make a decision which referral source would work best for them.
right. You know what it is for me, Dimitri? Um, I refer to doctors where I know what they have the best chance of hitting a home run out of the park. And if someone's just like a regular PT or a regular chiropractor and I don't know what their sweet spot is, like what
Sure,
position it is, it's really hard for me to refer.
definitely.
And so I even say the same thing to lawyers or to accountants. I'm like, what are you good at? And where
Yeah,
do you, like, what's your niche?
exactly. You're right. I believe in niche. Exactly. Very good. And then, so marketing. So you guys, when you spend money on marketing, speaking of which, and so, is somebody helping you with social media advertisement, or you guys do it in the office?
I used to do it myself. I now have a guy who helps us with the advertisements. I have a guy who helps us with posting and also does the copy for the posts. And I also have I have two video guys for internal. And I also have a friend who is an actor who coaches our doctors on how to act in front of the camera.
And you guys actually record videos for like on a monthly basis for the social media. Okay.
Yeah, we do a lot of videos, whether it's the iPhone or whether it's the big expensive camera that the video guy's holding.
Got it. Chris, and is there a reason you stopped doing it yourself? I mean, I'm assuming you wanted to run it yourself, right? Which I'm familiar with a little bit, and it just was too time consuming. Is that what it is, or you just didn't get it right?
I mean, if you told me 10 years ago that to get to where I am now, I would have to work as hard as I did, I don't know if I would have done it. So, like, really figuring out what I am good at and then delegating the rest to the best person. I used to hear entrepreneurs talk about this, like, oh, F it, I'm going to do it all myself. And then I'm like depressed because I have no time and joy for myself.
Really.
Like my partner's talking about leaving me because I'm working too much. It's yeah, there's not enough time to do all of it. We need to find people to team up with.
Sure. Delegating is difficult, and that's what differentiates a leader from a manager, right? Where you could actually do right delegation, train staff well enough so they do their job, maybe not 100% the way you would do it, right? But close to at least 80%, right? So
Yeah, seriously.
yeah, so definitely. So Chris, and when you set up budgets for marketing, you base it on gross revenue, net revenue. How do you do it?
Oh, I'm the wrong person to ask. Um,
Okay.
I I care more about my time and energy than I care about how much money I'm making.
Mhm.
So, and I should be better about this, but for me, it's like you do a good job and you're gonna give me this. Okay, here, take
But you
it.
guys, you do set up budgets, right, for marketing on like a quarterly basis, or that's not that you don't. It's not like
You're putting me on the spot, Dimitri.
that. Sorry.
um, as long as there's money in our bank accounts and our books say
Got
that we're okay, like
it.
I'm happy. But in the next few years, I bet I'll come back to you and be like, yo, Dimitri, I got that budget finally.
Okay, I will gladly do another interview in a couple of years to see what 2 years. Okay, very good. Chris, so I'll speak about some variance reports in a little while, but certifications. I know you have a few certifications, right, that you obtain. So what are these certifications that you hold?
Yeah, I used to be certified in active release technique. And then my mentor, who used to teach for active release technique, and myself and the other doctors, we weren't satisfied with their quality of certifying.
Mm-hmm.
So he broke off and he said his goal was to take the top 5% of ART providers and make them the best in the world.
Uh-huh.
So he started integrative diagnosis.
Uh-huh.
So myself and all of our other doctors are integrative diagnosis certified. We do manual adhesion release, which sounds very like active release technique, and also instrument adhesion release. So we'll use our hands manually or the instrument.
Which instrument you guys use?
He made it. It's this little metal credit card
Got
thing he made. He has like 100 different metal prototypes. And so it's just an instrument.
Got it. Got it. Okay. Very good.
Yeah.
Okay. And then the doctors that work with you, are they required to hold certain certifications as well, or that's not a requirement really?
They're all required to be Integrative Diagnosis certified. None of them were Integrative Diagnosis certified before they met me.
Nice.
So we invest in all of our doctors. I've told all of them they're going to do as many trainings and certifications as Dr. Brady offers. So I have my low back doctor going up to north of Boston once a month to train. And in the meantime, I train them as well, and so do the other doctors.
Got it. You have a budget for your staff education or certification as well?
I love that question. The budget is as much money as they can throw at it, they will.
Okay, very good. Okay, so and how many hours a week do you work? And let's break it down between treatments and actually managing the clinic and whatever else involved with running the clinic.
Yeah, that's continuing to shift a lot. I want to say it's probably a 40-hour week right now. A few months ago, it was probably a 55 to 60-hour week. Before that, or years ago, it was probably even higher than that.
Wow, okay.
And I did my toe in a lot of different types of healing stuff.
You froze for a second. You froze for a second, couldn't hear.
Oh, I froze. I explore a lot of different forms of healing, whether I'm taking on different clients doing stuff or exploring it myself, or I want to know, my intention is to do whatever I can to heal somebody's chronic pain or depression or anxiety or suffering.
Definitely. But that's the goal, you know, as an entrepreneur, right, a business owner. Your goal, right, definitely it's always working a lot of hours first, you know, a couple of years, but then you want to get to the point where you're working, you know, probably no more than 40 hours, if that's possible. And if you're not able to achieve that, maybe you're doing something wrong after 5 years. Or maybe you're just taking on a lot of different things that you shouldn't be or should be, but that's your kind of routine that you're used to. All right.
That was me, exactly.
Yeah. Okay. So, and how many patients you guys, I should say, patient visits a week do you have, or a month on average?
When we were at our max before COVID, we had 210 patients per week. Right now, we're about 150 patients per week. We spend about 15 minutes per patient visit. And again, people pay us more. We have much more higher margins per patient visit than most doctors' offices. So we're not trying to see, our doctor's goal is to see 80 patients per week. And if our doctors see 80 patients a week, they're making between 150 to 200,000 a year.
Wow.
So I love this model.
Yeah. So you have the productivity report that you guys run, right? With the doctors. So
what do you mean by productivity? How many patients they see?
Right. How many patients they see, you know, based, you know, so that's you run that monthly or quarterly?
We run them every week. We talk about them every staff meeting, what their numbers are.
How often do you have staff meetings?
Every Friday.
Beautiful. I like that. Very good. Okay. Yeah. Very good. Well, and then you guys keep track of cancellation rate?
Because we do the case fee thing, we don't really have cancellations, because that means they're just throwing away $4,000.
So let me clarify that. So if they paid for, let's say, I don't know, $4,000 for an amount of visits, and they miss a visit, they don't show up, or they cancel the same day, you still charge them for, so that visit is counted as part of their package?
We give them 3 strikes. And I think it may be twice in the past 3 years we've had to enforce it. But we give them 3 strikes if they don't show up, if they don't at least call us and let them know that they're late, if they don't follow our treatment plan, those are all strikes, and then they're out and they don't get a refund.
Oh, nice. Interesting.
And most people, when they invest that amount of money, they're like, most of our patients are wonderful. So we don't really have to deal too much with that.
Got it. Okay, very good. Chris, so I want to talk about reports a little bit. So what are the top 3 reports would you say you guys use in your clinic?
Yeah, I love it. Lead sources, where the leads come from, new patients. So we'll call it new patient consults because we separate the
Sure.
consult from the exam, and then patient visits.
Got it. And then do you differentiate between a lead where it came from a friend, a relative, or word of mouth? Like, do you have the differentiation at all?
We don't necessarily differentiate the type of person. We'll differentiate doctor category versus patient category, but it's more just if we know that we're getting more people for some reason from other people, we'll send out an email blast and say, can we incentivize them to refer even more?
Got it.
So do we spend more energy time there, or do we say instead of spending this amount of money on ads, let's give them $100 for referring somebody for the month? Things like that.
Got it. Okay. And then when the patient finishes with treatment, you give them some kind of survey to fill out to see, how they like the treatment.
Yeah, we give them an assessment at 6 visits and 12 visits.
Okay.
So our average case is 12 to 15 visits, so that's when we give it to them.
Got it.
And then it's really just spoken, we'll just ask them how they're doing, and then we're almost always asking them for testimonials, whether it's a written testimonial or a video testimonial to put on YouTube, Facebook, Instagram.
Okay. Do you incentivize that or not really?
Say that one more time.
Incentivize that?
I have before, but I don't think people cared, so we stopped. And in fact, we largely don't incentivize referrals either because we did, and I would ask people what they want, and after they're in the clinic, they're like, yeah, what are you gonna give me? So
Okay. All right. Very good. That's great. These are important. Very good. That's nice. And growth-wise, so you keep track of growth every year. If you guys are growing in terms of amount of visits per year.
yeah, and so up through March, we had been. So we went. Let me peel that back. February 2019 was when I hired the second doctor, and then we hired the third and fourth doctors in that same year. So that was February 2021. Then March 2021, we had our record number. Then COVID hit.
Got it.
So for the past year and a half, we've just been going up.
Okay.
So we're working to get that back.
Very nice. Okay, great. Chris, so for variance reports also, like, so you guys look at how many new patients came and how many, during the week, right? And how many actual visits, follow-up visits you had as well, right? You run that report, you said?
Say that one more time.
Your look at initial visit, right? Consult, you call it, right?
Yeah.
And then how many follow-up visits weekly? You differentiate between those type of visits?
Yes, we do differentiate. I know that the average case for us is 12 to 15 treatments. I haven't looked at that type of report anytime recently.
Got it. Okay, very good. Chris, so what is your favorite continuing education resource?
1,000% integrative diagnosis.
Okay.
The model, I think it's really hard to be chiropractors and physical therapists these days. I think the average income for a chiropractor is like 70 or 80,000. I think a PT is maybe 90. You might know better than I do.
Give or take, depending on the state, also 80,000. Okay.
And then you're probably working a certain amount of hours. If you're running a business, it's even harder. I don't want to play a game that I'm playing for that type of life. Like and I don't know if I would want that type of life for one of my friends who said they were considering that type of school. So to have a model where you're focused on chronic pain, which by definition is chronic and it's very hard to fix, where you can work 25 patient hours a week and make 150 to 200,000, that sounds nice to me.
Yeah.
So integrative diagnosis and Dr. William Brady that's what he's offering chiropractors and physical therapists.
Nice.
So I'm a huge, he's changed my life. He's changed my life.
Got it. Okay. Thank you for letting us know. And Chris, so just last couple of questions I have. So are you married? Do you have kids?
I'm not married, but I do have a partner, and we have one child and another child coming in 2 months.
Nice, nice. Congrats. Good.
Thank-
And then, so what is your long-term plan for the clinic? What do you see the clinic in another 5 to 10 years?
I love it. Um, we ultimately want to be the premier chronic pain clinic in the United States, where people are flying and driving in from all across the country and potentially the world. Um, I see having probably our lead body region doctor and then have a second body region doctor after that. I don't know if I have the energy to do more than that. Have a super beautiful clinic, probably with a functional medicine doctor who's really good at fixing thyroid disorder and liver stuff and fibromyalgia, all those things. Potentially having an energy healer. I've been seeing how much energy healing and meditation can actually heal people, and just address like the major components that are contributing to chronic pain that I'm not the best in the world at. So I want to have a place where people can come and really truly heal. And that's it.
All right, thank you for that. Chris, what advice would you give to a chiropractor that's just starting out, you know, I guess something that maybe you wouldn't do in 2010, like, based on your mistakes?
Working for somebody else or starting their own clinic? What are
Starting
you
your own clinic,
starting
starting.
a clinic? Yeah. Learn to think like an entrepreneur. I was not thinking like an entrepreneur. I was thinking like a pain doctor who was owning his own business.
Mhm.
Very, very dumb. In the past 2 years, I've been treating this like a startup. And the mindset behind that is super interesting because it causes me to make the decisions that cause it to grow to a place where I'm going to have the rest of my life after 35 years old that's going to be set up.
Mhm.
But because I was treating it that way, I just wasn't making smart decisions. How do I delegate? Who do I hire? Who's my specialist that I get for this?
Mhm.
Who's the best accountant I can have? Who's the best marketer I can find? And
Sure.
then focus on set goals and deadlines for ourselves and hit them for those goals and deadlines.
Yeah.
I can't believe how long it took me to find an advertiser. Like, why didn't I just set a really small deadline, talk to everybody I know, interview everybody, and find the advertiser who can help us? Why didn't I do that? Banging my head against the wall. I nearly killed myself.
Mhm. I mean, some people, I mean, I'm the type of person that likes to learn a task. Either it's, running reports or figuring out SEO or, social media marketing before I delegate. So
Love
this
it.
way, because the issue with marketers, for instance, you never know if they're doing a good job. It's like, it's hard to track sometimes a
Yeah.
referral unless, you get it from their website. With a physical therapy, they may just call instead, and it's hard to say if they found you through Facebook or your website or whatever else. So kind of, I mean, and that's fine. Sometimes it's better to spend those hours before you hire a marketing as the
Yeah.
marketing as well.
I'm actually the same. I have been a person who's like, I'll learn SEO first, and then I'll know if somebody is, when I interview them for marketing,
Yeah.
I can't talk to you. But I'm trying right now over the past year to shift that, to say, you know what, I don't know how to do, what am I looking for? I don't know how to do PR at all. So can I find somebody who seems like they know what they're doing and who has enough references of people who I trust that I trust them
Got it.
so that they can go, like, I want to shift that and I want to trust people.
Got it.
But
Okay.
I get where your head's at.
All right, Chris. That was it for today. I really appreciate your time. It was a pleasure speaking to you, and I'm looking forward to speaking to you in a few years.
I can't wait, my friend. Thank you so much for having me. I appreciate you.
Take care.